Hi, my name is Kira, and this is my SBAR Spotlight presentation. SBAR, or ISBAR, is an acronym that nurses use to help us present information about a patient to another medical professional in a comprehensive but also concise and effective way. ISBAR stands for identity, so who you are and who you're calling for, situation, why you're calling and what's the issue, background, any relevant medical information that might pertain to the specific issue, assessment, your report on your findings and the patient's current condition, and then recommendations, so what you think we should do next. Failure to use ISBAR could result in doctors making uninformed decisions, misidentifying patients, and increasing errors due to poor communication. So, an example of this would be I am calling a doctor. For an example, I would say, "Hi, my name is Kira. I'm calling for a patient in room 2017, age 16. He is here for sudden extreme pain in his chest and limbs, beginning at the end of his summer football practice, and he was admitted for exercise-induced acute vaso-occlusive crisis." My background for this patient is that he does have sickle cell anemia diagnosed at 6 months old. He has a history of having vaso-occlusive crisis, and he had a blood transfusion 18 months ago. He reports not drinking any water at practice and has a history of reticulocytosis, tachycardia, pulmonary hypertension from chronic hemolysis. My assessment is that the patient is A&O times 4. His blood pressure is 132 over 76. His heart rate is 122 with it was regular, no murmurs, and the radial pulse was +2. The respiratory rate was 24, and his oxygen was 96% on room air. His temperature was 99.6, with a pain scale being rated 10 out of 10. And the patient does report taking a Tylenol about an hour ago for his pain. His abdomen is non-distended, no localized tenderness, no edema, and his skin is warm, pale, and diaphoretic. My recommendations would be to start an IV fluid to rehydrate the patient, give some IV pain medications like morphine or hydromorphine, to monitor the vital signs, especially the SpO2, because we want to assess for his need for supplemental oxygen. And then some lab values I think would be important to get is the CBC, the reticulocyte count, and his electrolyte counts. Thank you.